Hello, everyone. I hope all of you all have had a very fruitful week post Diwali, and we've come now to the weekend. So today is, as usual, our Facebook Live session. I am Dr. Pallavi Kalghadgi, working at Zenith Advanced Fertility Center in Pune. And before we commence and start our Facebook Live, I am very happy to share some news. Tomorrow, that is 13th of November, um, we are, Zenith Advanced Fertility Center is conducting a free camp in Pune at Sinhagad Road. The camp is going to be there between 10 a.m. to 5 p.m. tomorrow. It's basically for any couple or any woman who is undergoing issues with infertility or gynec issues, or in general, as a couple, if you feel the need to understand about your reproductive health, please feel free to come down and visit us. The camp is free. You will get all the information, all your queries, all your concerns will all be taken care of and handled on a one-to-one basis. Um, so please do come. The details of the exact address and details for the camp is probably flashing on your screen right now. So I'll just give you a couple of seconds to take a photo or a snapshot so that you can read the pamphlet in more detail. Okay, so then let's move on to today's topic. We are going to be talking about preconceptional counseling. So, what is preconceptional counseling? Try to understand this term as a preparation. So, imagine you're going for a trip, or you are prepare, or you have to give an exam. What would you do? You would prepare, right? You would open your books, you would study. But why would you do this? So that you score better in your exams. Similarly, preconceptional counseling is a kind of preparation you would undergo basically to have a better pregnancy or a better pregnancy outcome. Scientifically, we can define it as a set of interventions that aim to basically identify and modify any medical, behavioral, or social risks to the woman's health or the pregnancy outcome, and we try to prevent it and manage it. In simple words, it is just the care that you receive before your pregnancy. But why is this so important? Basically, if you mothers who take preconceptional health or care, it helps to improve their reproductive outcomes. Now, when I say reproductive outcomes, it means that the time period when a couple is trying to conceive, or when the couple has already conceived, but you divide the antenatal period into two halves, the first half, the second half. All these periods are, a couple or a woman is prone to falling to some into some complications or risks. Even the postnatal period or the period during delivery can get complicated if the planning of this pregnancy has not been done well. That is why, and now that we have the awareness of it and we have the means to understand or to screen for any such factors, it becomes more easier to control the reproductive outcome. It reduces the maternal complications or the maternal deaths. Many a times, with the ignorance of not understanding that you are already prone to a certain condition, you may carry that risk factor into your pregnancy, which may lead to a complicated pregnancy and a complicated delivery as well. So this will further affect the mother as well as the baby. So even the neonatal outcome or the outcome of the newborn. For example, having a low birth weight baby, where for whatever reason the baby's growth or the weight has not was not appropriate during delivery, or ending up into a premature delivery, that is a delivery before 9 months of pregnancy. So all these outcomes can be reduced by having preconceptional counseling. Now, what is it that we as medical practitioners do when we are talking about preconceptional counseling? The first and the most important step is to describe the issue of concern. This is going to be basically by getting some data from the couple, from both sides, by getting some data about their existing history or their past history. We can actually pinpoint any issues of concern. Following that, we will review them as risk factors that could be associated with the pregnancy. If there is already a pre-existing chronic illness, say diabetes or thyroid or epilepsy, these conditions, the effect that these conditions could have on the pregnancy is going to be actually described to you, and you would be counseled on that. And finally, planning interventions, as in stepwise interventions that you can take uh, to have a positive impact on the pregnancy or the perinatal outcome. So these are our primary objectives when we talk about preconceptional counseling or preconceptional care. Now, like I said in the first point, we are we have to describe the issues of concern. Now, how would you understand when a couple walks in? How would we as doctors understand to identify these issues? So basically, these are some screening factors that will help us to identify, like the medical and the surgical history of both partners, previous obstetric history. By it means if you have undergone any miscarriages or any pregnancy losses, or an ectopic pregnancy, or even a biochemical pregnancy. So if there is any significant history there, that would help us understand a lot. Personal history, like your basic habits, whether you're drinking, smoking, and other addictions. In fact, even your weight, whether you're even in the appropriate weight range, that is also screened. Your family history, whether you carry any genetic diseases or any carriers that you carry. Then a general physical examination, of course, that will tell us a lot. And finally, some laboratory tests. These are the screening factors that will help us understand the first point here, that is the issues of concern. Now, what are the scenarios in which a preconceptional care can be initiated? By this, it simply means that when can it start in your life as a couple, as a woman? When can this preconceptional care or concern be initiated in your life? So, the first and most important is when you visit a doctor in your reproductive years. This can mean from a wide range of married women, unmarried women, whether you're having any menstrual irregularities or any other concerns which can correlate with your pregnancy or with your future pregnancy whenever you plan it. That is also preconceptional care. Then during annual health checkup, along with taking care of the other aspects of your health, like your liver function, your kidney function, your reproductive health is also important, and that is when preconceptional care can also be initiated. Premarital counseling, now this is a very important concept actually, but not well established or not well taken into consideration. But basically, premarital counseling can be between a married woman or an unmarried woman, or a couple who is just dating and they want to plan their future, or a couple who's about to get married who want to plan their contraception and want to know and want to understand when is the right time to conceive, All this comes under premarital counseling and is a very, very significant topic in preconceptional care as well. Basically, this will help you actually timeline your entire reproductive uh, years. So when is it ideal to have a pregnancy? Are you even in the bracket where you can wait for your pregnancy, or you need to plan for a pregnancy immediately? All this comes under premarital counseling. Postpartum, that is post delivery health checkup. After you've, again, this is a very important time period in your life where you have to consider preconceptional care, because after you've had a delivery, spacing your pregnancies or the time gap between two pregnancies is very important, because this is not only going to affect you as a mother at that time, but it is also going to affect the well-being of your next pregnancy or the next newborn. So spacing and taking the necessary nourishment, healing, giving the opportunity to your body to heal from the first pregnancy and then planning for the second, this is also an objective of preconceptional care. A visit to the doctor with a negative pregnancy test. Again, as a couple, if you are trying to have a pregnancy, or if you're trying to conceive but are getting negative pregnancy tests constantly, it could be a very simple solution that maybe you're just not aware of the reproductive window. So this also comes into uh, preconceptional care, to understand how your body functions and why is it that you are constantly getting a negative pregnancy test. Are you well aware of your menstrual cycles and so on? So that is again a scenario where preconceptional care can be initiated. Again, for infertility, a couple who is trying for a year and is not able to conceive, that also needs to visit the doctor, and that is also a part of preconceptional care where evaluation becomes an important aspect. And of course, lastly, for during an emergency visit, this usually, by emergency it means anything related to your, a pregnancy that could, or a, unwanted pregnancy that happens in your reproductive years. So it could be an unwanted, a failure of contraception, it could be an unwanted pregnancy, it could be an ectopic pregnancy, it could be a miscarriage, or it could be a biochemical pregnancy. All these term to be emergency visits, and that again can be a scenario where your preconceptional care can be initiated. Okay, so now that we've spoken about what is preconceptional care, when can you get it, from where can you get it, what is the basic steps that we would do in a preconceptional counseling, let us talk about some just small points about what it entails, like what is the little small things that you would experience when you go visit your doctor for this. First and most important is the nutrition and supplementation. So we all know that whatever nutrition the baby gets is from you, is from the mother, right? So if you are healthy, if the mother is healthy, then the baby remains healthy. So primarily, the most important supplementation that we talk about while conception is folic acid. Now, folic acid is definitely given in the first 3 months of pregnancy, but it is also advisable to take folic acid preconceptionally, probably a month or two, or even 3 months uh, before pregnancy, or even when you're trying to conceive. Basically, folic acid is very important for the development of the brain and the spinal cord of the growing baby. So, if there is a deficiency in folic acid, you are more, rather, the baby is more prone to getting NTDs, that is neural tube defects. So, for a simple solution is just taking adequate amount of folic acid. There is usually a standard dose that one follows for folic acid. However, in some indicated cases, obviously your doctor is going to talk to you about that, but in some indicated cases where you have had a history of having a newborn or a fetus having neural tube defects, or if you are deficient in folic acid for whatever reason, or if you're taking some medicines like anti-epileptic medicines which reduce the folate in the body, that is when you may need to take excess amounts of folic acid where a higher dose will be prescribed. Optimizing your weight. This is true for both overweight and underweight women. Obesity, as you all know, comes with all sorts of complications. So in the non reproductive aspect, it can lead to cardiac diseases, it can lead to high lipids in the body, and so on. It could lead to diabetes, hypertension. Similarly, having a high or being obese when you conceive can lead to some maternal complications during your pregnancy. Primarily, obesity is known to cause miscarriages in the first trimester of pregnancy. So, because again, there is, there is a lot. Obesity is known to carry some hormonal imbalances, because of which maybe you are prone to having miscarriages. Secondly, uh, developing diabetes during pregnancy, if you're obese, is also an important risk factor. Developing or going into preterm delivery, preterm labor is also something that we see in obese women who conceive. Similarly, being undernourished, not or being underweight, is also significant, especially because this is more important for the baby, because you may, if you are anemic or if you are underweight, if you are deficient in some vitamins, or you may it may get, obviously the baby is not getting the enough nourishment, and the baby may end up becoming a low birth weight baby where the growth is inadequate, or intrauterine or like an or a intrauterine growth restriction baby where the growth is not adequate, or you may even be prone to getting PIH, that is pregnancy induced hypertension, which can again become an important complication during pregnancy. Then let us talk about immunization. Basically, um, having the necessary fighter organs in your body help, because your immunization is your baby's immunization. So having the necessary antibodies, by fighter organs I mean antibodies, they will help protect the baby as well. So based on your complete history and your past health, the doctor will be able to understand if you need to be immunized before pregnancy, and that is actually going to help even in your conceptional period. So especially in cases of rubella, so so complete history and a complete laboratory analysis will help us understand if you need any further immunization. Managing your addictions. Smoking definitely is contraindicated, and this is true for both male and female. Lot of studies have shown that smoking affects the in males, smoking affects the motility as well as the count in the sperm. So in the semen, so the sperm count and the sperm motility do get affected in males, and in females smoking is definitely known to cause some disturbance in the ovarian function and the function of ovulation. So that brings us to the first point, where it can affect fertility issues. And secondly, for women who do smoke or who have smoked in the preconceptional period as well, are known to again carry high risk factors for having low birth weight babies and premature delivery. Similarly, alcohol. Now, alcohol is also known to cause effect to the sperm motility and the sperm count. And it is also known to be very, very harmful, especially when you are pregnant and you consume alcohol. But there is no, and it is not ideal to you to consume alcohol even in the preconceptional period. Unfortunately, there is no exact quantity or amount of alcohol that is allowed. So the best advice that you can get is to avoid alcohol even in the preconceptional period. Alcohol and pregnancy, as in consuming alcohol while you're pregnant, is also known to cause fetal alcohol syndrome, and it can also affect the neuropsychological if functioning of the newborn. Moving on to some medications. Now, when I say medications here, it just means that if you are already suffering from some pre-existing illnesses, like say you're taking epilepsy medications or diabetes or thyroid, some of these medications are not safe to be taken during pregnancy. So they act as a toxic agent for the baby. So it is very important to uh, change these medicines preconceptionally so that it does not affect the baby even later on. Also, these medications have to be you have to transition to a new set of medications. So it is important to make sure that your levels or whatever the function of the medicines that have been changed are actually working for you. So again, preconceptional care takes care of this as well. Moving on to okay, so here we are talking about screening of some sexually transmitted diseases as well as HIV. It is known that as a couple, if you are a diagnosed, or you or your partner are diagnosed with say HIV, there is a high risk of this of HIV being transmitted to the newborn as well. So, getting screened, getting treated for the same, and then planning the pregnancy is going to be of use. Similarly, having some pelvic infections, untreated pelvic infections, or some sexually transmitted diseases, or if you all are well aware of the term pelvic inflammatory disease, all this is an infection. All these are infections to the reproductive organs, and because of this, a couple may experience infertility. That's point number one, and also ectopic pregnancy, which you all know is a very severe complication. Basically, because of the lack of functioning of the tubes, you may end up into an ectopic pregnancy. So screening for these infections and getting treated for the same helps to reduce the chances of this. Similarly, when you carry forward these untreated infections into your pregnancy, you have a high risk factor of developing preterm delivery or premature leaking, where eventually the baby also may end up having some complications and may need an NICU admission, and may have a very long recovery after that. So a simple screening and treatment for the infections can save us from all of these complications. This is also a very, very important aspect in preconceptional care. Now let us talk about some of these chronic medical illnesses which a couple or a woman may already be having, and how this adversely affects pregnancy. So let us talk about a very common, especially nowadays, because women are getting married late, they plan for a pregnancy late. So diabetes diabetes is more of a lifestyle reason nowadays. So because of your sedentary lifestyle, your lack of exercise, obesity, diabetes is becoming very common among even the younger generation. So uh, if at all you are diagnosed with diabetes, and you that could carry a lot of complications during your pregnancy. I think I've already mentioned a few before. but it can cause um, like premature delivery in your during your pregnancy. It can cause many infections. Diabetes is known to lower your immunity, so you may be prone to getting many infections, and those infections can lead to premature delivery. It can lead to infections in the baby as well, fetal infections, which can be carried forward. It can cause problems even during delivery, because the baby's weight in a diabetic mother increases a lot. So that can cause issues during delivery, and hamper the postpartum period as well. So, as per data, it has been shown that the HbA1c levels, that is the average blood sugar levels of 3 months, should be 7 or less than 7 before a mother tries to conceive. So, preconceptional care will make sure that you are well within the range to avoid these complications. Similarly, hypertension, blood pressure. So, if you're already on any blood pressure medications, some of these blood pressure medicines are again toxic for the growing fetus. The fetus, when there is organogenesis, or when the organs are developing in the fetus, that time these medications affect the growth or the development of the organs, and can cause some fetal anomaly. That is why switching over to a medicine that is allowed, or that is okay to take during pregnancy, has to be done well in advance. Similarly, in women who have thyroid disorders. Now, um, if you're already taking medications for thyroid, sometimes you may require a modification in the dose, because the pregnancy may increase the demand of the thyroid medication. So, making sure that your thyroid levels are normal and modifying again the dose appropriately is an important factor. Similarly, with epilepsy, I already spoke before. Taking epilepsy medications can reduce the folate levels. That is why taking high doses of folic acid becomes necessary. Also, making sure that the correct medicines are given during pregnancy, so that during pregnancy the woman should not experience a convulsion or a seizure, which can again further cause complications. So taking appropriate medications for the same is also important. um, let us talk about cardiac disorder. Now, there are many conditions, or women who already have cardiac diseases. There are conditions which are not favorable to even plan for a pregnancy, because it may cause the complication of it may cause a higher level of complication. So, if you or your family have any history of cardiac disorders, or if your sister has had any history of cardiac disorder that was actually diagnosed during her pregnancy, it is advisable to, pass on this message to your doctor, so that you can be evaluated and make sure that you don't face the similar complications. Also, for when a woman who has a cardiac disorder plans to get pregnant, her entire time period right up to her delivery needs to be planned, so that she doesn't end up having complications even during her delivery. Similarly, if you are diagnosed with cancer, unfortunately, um, what how do you, because cancer includes radiotherapy, chemotherapy, all these treatments basically affect reduce the fertility, has an effect on the fertility impact. So considering fertility preservation becomes important. Now, let us also talk about this concept of recurrent pregnancy loss. Basically, if in your past, if you have experienced a pregnancy loss, if you have experienced miscarriages, if you have experienced biochemical pregnancies or an ectopic pregnancy, After you, if you've had two or more such episodes in your past, it is ideal and mandatory to get evaluated to make sure that this does not repeat. So the solution, like I said, can be a simple thing, but unless and until you are evaluated, you wouldn't be able to prevent such losses. So it is important. This again comes as an important factor in your preconceptional counseling. Now, this is last and final. This is the genetic counseling, which is again very important. With your basic history, your doctor can be able to understand if you are a carrier of, or if you could be a carrier, and following that, a set of screening tests can be done to make sure if you're a carrier or not. If at all your doctor feels that you come into the bracket where the genetic history is significant, you may be referred to a geneticist, and further getting evaluated and understanding as to what risk could your offspring carry is also an important aspect, and that is how it is going to move on. So this is basically a summary of what all I spoke about. It's a checklist for any preconceptional care. You can have a look and you can just take a screenshot of the same. This is basically, I think all of the points are included here, where we are talking about smoking, alcohol abuse, folic acid supplementation, getting counseled about genetic disorders, body weight, diet, family planning, and of course assessments where um, you can where you're physically assessed and your past history can give us some data. So just go ahead and take a photo of this where you can get some idea as to what all is included. Basically, to put it in simple words, there was a lot of data in today's Facebook Live, and probably it is very difficult to grasp everything easily. But just remember that nowadays we have the ability and the tests and the information that is needed to find out if there is any, if there can be, to anticipate if there can be any issues during your pregnancy. So it's always advisable to go and get and prepare yourself to these factors. So that is what the bottom line of all this data your doctor knows, so you don't have to worry. But the only thing that you as a woman or as a couple can do is to take that step and go and visit your doctor for a preconceptional care. That was today's message, and I would again like to remind all of you about tomorrow. The camp that is the camp that we have is in Pune on 13th of November at Sinhagad Road. It's between 10 a.m. to 5 p.m. Please come and visit. If you're not sure, please, there are contact numbers here. You can always call and ask us, and we will let you know any information that you need to on the phone, and you can come and visit us. Um, this is going to be a very good outlet for all of you who have not who want an opportunity to go and talk to a specialist on a one-on-one basis. So please take this opportunity, and I hope to see all of you there. Have a very nice weekend, and see you soon.